Welcome to this short presentation about the Bio-on-Water Synergetics Accuion copper-silver disinfection technology for the dental industry. In this video, we will demonstrate the necessity for copper-silver ionization technology for the dental industry. Harmful, waterborne pathogens are present in many sensitive environments. Dental practices pose a completely underestimated risk. Do these thoughts sound familiar to you? It cannot happen to us because we've never heard about it. This is not an issue for our industry or practice. How are those excuses going to help you when reality strikes? There's always a first time. Can you justify ignoring this topic? Let's look at the facts, which have been confirmed in scientific studies in various countries. Dental chairs are notorious for breeding harmful pathogens. Heavy colonization can occur even in brand new dental chairs. Pathogens are present in the water and they can enter the mouth, respiratory tract and lungs of patients, staff and dentists alike. Water samples collected from 28 dental facilities in 6 US states were examined for the presence of Legionella. Legionella was detected in over 2/3 of the dental unit water samples, with up to 10,000 colony-forming units or CFUs per milliliter. The limit for tap water is 500 CFUs per milliliter. The bacterial counts in the water lines of the various handpieces had values in the order of 3 million CFUs per milliliter. After flushing the water lines for 2 minutes, bacterial levels never dropped below the limit required for drinking water. Health-threatening levels of Legionella in potable water were significantly lower than in dental unit water. In summary, dental water is not only worse than tap water, one study found it to be worse than raw sewage. Water coming out of dental units not only ends up in the mouths of the patients, but through the use of high-speed drills also enters the respiratory tracts of staff and patients as an aerosol. This is a risk especially to immunodeficient patients, dentists and staff due to the long-term exposure to these pathogens. Studies have indicated that dentists and dental staff have higher rates of respiratory infections than the general public. This is an occupational health and safety risk. Pathogens display resistance to most chemical biocides that can be considered stunning. This has been verified in numerous scientific studies. What are the issues? The problem is the biofilm. This is a thin, slimy film of bacteria that adheres to the inner surfaces of the dental unit's tubes. Water feeding the dental unit is not sterile, as it naturally contains certain species of microorganisms. Microscopic imperfections on the internal surfaces of the water lines allow those microorganisms in the water to induce the formation of colonies, which in turn initiates the establishment of a biofilm. In a dental unit, we have low water flow and stagnant water, for example over the weekend. To increase patient comfort, the water is also heated, increasing the microbial growth rate. Water to the dental units normally contains less than 100 CFUs per milliliter. Water coming out of the unit, however, contains 1,800 times more bacteria. Contamination of the water occurs from a reservoir of microorganisms, the biofilm. Water entering the unit becomes contaminated in the water lines by contact with biofilm. The age of the dental unit has very little influence on the microbial count of the water coming out of the unit. The microbial quality of the water feeding the unit can thus not be used as an indicator of the quality of the water coming out of it. What are the disinfection methods used today and why do they not work? Flushing the water lines. This reduces the bacterial counts but usually does not allow levels to fall below those acceptable for drinking water, unless unrealistically long clinical times are used. Sterile or distilled water. Sterile water circulating in a tube covered with a biofilm will become as contaminated as normal tap water. Biocides, such as chlorine, are effective at eliminating bacteria in suspension in the water, but do not eliminate the biofilm. Also, they don't have a residual effect. That means they volatilize or break down over time. Freezing the waterlines could eliminate the biofilm, but this technique cannot be applied to dental units. Antibacterial filters near the outlets of the waterlines only hide the problem, and such filters must be changed frequently. Tubes with antimicrobial properties, composed of materials that do not promote the formation of a biofilm, could be an interesting solution, but no studies have demonstrated the effectiveness of such tubes over the long term. So how does the copper-silver ionization disinfection technology work? All microorganisms have an exterior envelope called the cell wall or cell membrane, which is essential to the integrity and function of a microorganism. The cell membrane is electrically charged. Through an electric current, copper and silver is turned into charged ions and added to the water stream. These copper and silver ions are electrically attracted to the cell membrane. In the case of most relevant bacteria, including Legionella, the copper and silver ions have a synergistic effect to disrupt the cell's membrane and metabolism to the point where the cell dies. Once the microorganism dies, it loses its charge. This releases the copper and silver ions. As they are still attracted to other charged microorganisms, they will continue to work safely and effectively as a biocide, making copper-silver ionization a residual method of disinfection. Let's look at the bio-and-water synergetics Accuion technology in practice. For a dental practice, usually only one unit needs to be installed for the whole building, supplying water to all the dental units at once, which is also a huge cost advantage. Mains water enters the unit. The flow of the water is measured, which ensures the correct amount of copper and silver ions in the water. Water enters the ionization chamber and is dosed with copper and silver ions. The water, which has now become a biocide, then enters the building. For servicing purposes, bypass valves are installed, eliminating any downtime of the water supply. In summary, the bio-and-water synergetics Accuion system keeps costs down because usually only one unit is required per practice. We have a proven track record in the dental industry with installations across a variety of practices. There's no downtime during servicing. The system is fully scalable and thus suits any water flow. Precise ultrasonic and electromagnetic flow metering is used, allowing for proportional, accurate dosing of copper and silver to ensure effective disinfection. Full system visibility can be achieved through the optional remote access features of our Accuion system. For further information, please visit our website or call us on 1-800-246-606.